The House of Representatives Committee on HIV and AIDS, Tuberculosis and Malaria says it is working towards around 90% reduction in malaria mortality rate by 2030. Chairman of the committee, Honorable Amobi Oga, who was speaking during a news briefing at the National Assembly on Monday, said the House is not unmindful of challenges being faced by Nigerians in the fight against this ailment, especially in the fight against the control of malaria in the country, which appear to defile solutions. He said the committee would work with relevant stakeholders to achieve the targets.
The technical strategy includes reducing malaria case incidence by at least 90% by 2030, reducing malaria mortality rates by at least 90% by 2030, eliminating malaria in at least 35 countries by 2030, preventing a resurgence of malaria in all countries that are malaria-free. The prevalence of fake malaria drugs will be looked into to avoid further deaths recorded. We will carry out our oversight function to ascertain the role of primary health care in the rollback malaria program. We will also ensure adequate implementation of legislation geared towards the eradication of malaria in the country. Where such legislations are not adequate, we will work to provide the needed amendment to such existing legislations for the general good of the Nigerian people. To this end, we will work with all ministries, departments, parastatals to also ascertain the level of awareness and sensitization created in Nigeria.
The lawmaker also said the committee will further enhance the fight against HIV/AIDS by empowering the National Agency for the Control of AIDS, NACA, through legislations and proper funding.
Our scope will also include the National Orientation Agency, NAFDAC, NCDC, Ministry of Health, among others. In the area of HIV/AIDS, the WHO reports that the disease remains a major global public health issue, having claimed over 32.9 and 51.3 million lives so far, with ongoing transmission in all countries globally. The WHO has also expressed concern that some countries are reporting increasing trends in new infections, which was previously on the decline globally. Nigeria is not left out of this trend. There is still no cure for HIV infection. However, with access to effective HIV prevention, diagnosis, treatment, and care, including for opportunistic infections, HIV infection has become a manageable chronic health condition, enabling people living with HIV to live long and healthy lives.
The committee is therefore soliciting support of the media in area of coverage and dissemination of all rolled out activities on malaria, HIV and AIDS, and tuberculosis.